Good day everyone. Welcome back to Gifted My YouTube channel. Today I'm going to be sharing with you on the topic menstruation. So we're going to know the symptoms and the causes of what premenstrual syndrome. And before then, today is your first time of coming across my YouTube channel, please like, share, comment, and also subscribe. And as well, you can turn on the notification bell so you don't miss out on our videos. And if you are a return follower, this is Gifted Smile saying a big thank you. So let's go to the topic of today. We'll start from what normal menstruation. In this normal menstruation, we have 4 phases. We have the menstrual phase, we have the follicular phase, we have the ovulation phase, and we have the luteal phase. Okay, so let me say about this follicular phase. It is when your body creates a small sac. The follicular phase, it is when your body creates a small sac that can mature into egg. That is when you experience what follicular phase. And then ovulation phase, it is when your egg is matured and released from the ovaries to the uterus. It is when your egg is matured and releases from your ovaries to the uterus. This is why we have menstruation. Because why? Menstruation only comes out through what? Eggs. When the eggs get to hatch, that is when we get our menstruation. So when the egg is not hatched, which means that person is pregnant. So when your egg is matured and it's released from your ovaries to the uterus, this leads to what? Menstruation. Okay, so what are these signs and the symptoms of normal menstrual cycle? Most of us, we have our personal and our own way of having our menstrual cycles. So, one, you can have this abdominal cramps, where you begin to have pains all over your lower abdomen, so severe, and you have those pains. So, abdominal cramps is one of those signs and those symptoms that you feel when you're expecting your flow. Some persons, when they are seeing their flow and they don't feel that normal pain they used to feel, they begin to become they are always bothered. You understand? So once they start feeling that pains, they know, okay, any moment from now they'll start having their flows. So when you have these abdominal cramps, this leads to menstruation, and it is caused by urine contraction. Abdominal cramps, it is caused by urine contraction, which help to shade the lining of the uterus. It helps to shade the lining of the uterus. Okay, abdominal cramps, it is caused by urine contraction, which helps in the lining of the uterus when a pregnancy does not take place. Okay, when it's like this, it helps when the pregnancy. It only happens when pregnancy does not take place. That was why I said when some persons have this pain, they understand they are getting their menstrual flow. So with this, you are having your menstrual flow, which is when the pregnancy does not take place, you are permitted to have stomach cramps. You're permitted to, you begin to feel it. That is when you are having your menstrual cycle. And we have breakouts. Okay, we have the breakouts, we have the tender breast. This tender breast does not really happen to so many, but some persons it happens to them when you begin to have this heaviness on your breast. This heaviness on your breast, you have this heaviness, and it's so painful. When a little thing you touch on your breast, you feel that pain. So with this, you have you can also get the signs and the symptoms through tender breast, and you can also have these signs and symptoms through breakout, and you can also have this under fatigue. You have it under fatigue, you have your signs and symptoms under fatigue, you have the signs and symptoms under bloating, and you can also have the signs and symptoms under what? Bowel issue. What is this bowel issue? It is when what you might also when you have bowel issue, the only thing you can experience is you begin to feel diarrhea, constipation, and nausea problem. Okay, some persons, our menstrual syndrome comes in different forms. This one is under bowel issue. When someone has bowel issue, the signs and symptoms the person is permitted to have is what? Diarrhea, constipation. Okay, the person begin to have diarrhea, person begin to constipation, high constipation, and at the end the person has nausea problem, has dizziness. Okay, and you are permitted to also back of the head. Okay, I'll come across so many people, they'll tell you, I'm having this heavy headache, and when you get to question them and you get to ask them, they'll tell you yes, they are expecting the monthly cycle. For that reason they have what? This headache on the back head. And you have mood swings, your mood swings. Okay, we have on the mood swings, which was it attached to what? Emotional symptoms. So your mood swing what can also come when you are expecting what? Your menstrual cycle. So it's also a sign and a symptom for your menstrual cycle. You have depression, you have irritability, you have this anxiety. So it is a sign and it is a symptom of what? Menstrual cycle. And we have what? Lower back pain. Lower back pain. When some persons has this lower back pain, this is also it's also one of the signs and symptoms of what? Menstrual cycle. And we have trouble in sleeping. When you begin to have this eye pain, you have trouble in sleeping. Someone that has this lower heavy pain syndrome, it is difficult for you to sleep. You cannot sleep freely. So when you have this, it also helps what? It's also one of the causes and the symptoms of what? Menstrual cycle, which is what? Problem in what? In sleeping. So with this, what are these PMS? PMS, another word is what? Premenstrual syndrome. What are these PMS? PMS comes with so many symptoms. It comes with so many things. And some of those symptoms are found with some women, and not every woman has this symptom. So which is, some of these symptoms are what? I jotted some down. I'll have to name them. I have tension and or anxiety, trouble of trouble fall asleep. We have appetite changes and food craving. We have what? Change in libido. We have poor contraction. Do you know that when some persons are having their menstrual cycle, that is when they have the urge of sex? That is why they say change in libido. That is where they have this high urge of making an intimate. Why some persons, when they are having this menstrual cycle, they stay far for so many things. Okay, so we have some physical signs and some symptoms of this premenstrual syndrome. We have joint and muscle pain, headache, we have fatigue. And what we have is, if you are the type that you have this high severity of pain when you are expecting your monthly cycle, please, if at all you have drugs that you are taking, but most times these pains can come in a way and to start disturbing your daily activities, please try go see your doctor. Okay, we advise you do what? You see your doctor. So if you are part of these people, please try what? You see your doctor. You don't just take it as a normal pain, because most of this pain come with so much force of severity of pain. So when you are one on this category, try and what? See a doctor. And also we have what? The signs and symptoms of what? Of this PMS, which is premenstrual syndrome. It can also lead to what? PMDD, which is what? Premenstrual dysphoric what? Disorder. Premenstrual what? Dysphoric disorder. That is the another name of what? PMS. Under PMS we have what? PMDD, which is what? Premenstrual what? Dysphoric disorder. and this can come with what intention, with tension, which is all these things comes the same. Comes with same tension. You come with irritability, contracting, feeling overwhelmed. So when you have all of these pains, your body has to feel differently. You have to feel overwhelmed, and you feel dizzy, and you feel so lazy. So with this, I think you will be able to know how you feel your lower. You have to feel your what premenstrual syndrome. Okay, so if you have severity of menstruation, please try go see what's your doctor, so you know what to do. If at all, even if when you have some tablets you do take, at times when your body is used to something that you take often and often, it doesn't work. That is why you say, I used to take this tablet, but now when I take it, it does not work. Now when I take it, it does not work. Not that it does not work. The thing is, when your body is used to it, it does not function, it does not work anymore. It does not have effect on your body again. So for that reason, instead of you to continue taking drugs that will not work, rather than damaging your body, we advise what you see the doctor. Hi everyone, you're welcome back to my YouTube channel. This is Gifted Smile YouTube channel. You're welcome back. So as we know today, so many persons, you might be among those that has what too much heavy bleeding when you're seeing your menstrual flow. When you're seeing your flow, you feel this too much heaviness in your period, on your menses rather. So this topic is for you. And today we have some signs that I'm going to bring out to you that cause those things that leads to what this too much heaviness in your menses. But before then, if today is your first time of coming across my YouTube channel, please like, share, subscribe, turn on the notification bell so you don't miss out on our video. Thank you so much. And if you're a return follower, this is Gifted Smile saying what? Big thank you. So let's go to the topic of today. Those things that leads to what? Too much heaviness in our menstrual flow. Today I'm going to start on the topic on the first page, which I'll call what? Dysfunctional what? Ovaries. Dysfunctional what? Ovaries. This one is when your ovaries is not functioning well. When your ovary as a lady is not functioning well, yes, with that it can lead to what? Heavy menstrual what? Cycle. So two, I have what? Uterine fibroid. Uterine fibroid. We all know what fibroid is. We all know what fibroid can cause to human. What fibroid can cause to human. So when you have fibroid, when there is fibroid in the uterus, it can lead to what? Heavy flow. It can lead to what? Heavy menses. When there is fibroid in your uterus, it can lead to what? Heavy menses. Okay, so when you have this heavy flow, you have so many signs, so many things can cause it. Okay, you don't basically say, my hormonal system is imbalanced, my hormonal system is not balanced. Yeah, hormonal system can be added, but there's other things that you need to know that leads to what? Heavy what? Menstruation. So we have this hormonal imbalance. Hormonal imbalance can result to what? Heavy flow. When your hormonal system is not balanced, it can also lead to what? Heavy flow. Then we have also endometriosis. Endometriosis is what? Is when things that are supposed to be found in your endometriosis is not found there. Where the things that are supposed to find in your endometriosis are not found there, maybe at the end of the day, those things are not be found at on your womb, on your fallopian tube. Those things can also lead to what? Your heavy menstruation, what? Heavy flow. So 5, I have what? I have the adenomyosis. Adenomyosis is composed of what? I will give you as an example, like when someone has outer layer, inner layer, and what? Middle layer. So with this, it is also found when the things that is supposed to be at the inner layer is found at the first layer. It can also what? Lead to what? Heavy menstruation. It can also push your menstrual flow to become what? Very heavy. And also we have what? The the intrauterine, the have what intrauterine what complication. It is what coil can cause heavy bleeding. So which means most women will go for what family planning. When you go for family, there's this thing we call coil. It is being placed inside the body of your woman. It can also cause what this heavy menstruation. Okay, so I also have what complication during pregnancy. Complication during pregnancy can also lead to what heavy menstrual flow. So also I have what the polyps is an extra tissue. The polyp is an extra tissue that can be found in the body. It's an extra tissue that can be found in the body, which can also lead to what heavy menstrual flow. So also we have what the cervical cancer, the cervical cancer. We have and the what womb cancer. Cervical cancer and womb cancer are together, which cause what abdominal what growth. These are growths that comes through your what the abdominal system, and through this you can get what heavy what menstruation. And we have what medication like depot injection. Depot injection, you will know what it is and what it's used for. So when you have depot injection, you can have menstrual flow very heavy. That is why it is advisable when you're taking a family planning. Always go for tests, go for checkup. Knows what is suitable for your body, knows what your body can take and what your body cannot take. So with the process, when you take what your system does not align with what those things that your system cannot take, it can also what lead to what heavy menstruation. And also we have a pelvic inflammatory disease. Someone that has pelvic inflammatory disease, STD, PID, those things what can lead to what heavy menstruation. When you have infection or treated infection that has accumulated in the body, it can also what lead to what heavy menstruation. Then we have what medication at depot. Okay, we have a bleeding disorder. We have what bleeding disorder. So these are one of the things that leads and that cause what heavy menstruation. But we always tell people, when you are one of this, when you are found in this category, you don't just go take some pills, or you don't just go continue taking pills that you take before. We advise you always go see your doctor. So thank you so much for watching my video today. Don't